My life has turned around so much. I'm happier, I sleep better, and when I get up in the morning, I'm ready to go. My name is Cathrine Jones. I'm 61 years of age, and back pain and SI joints have plagued me for most of my life. I had a hard time trying to find a doctor to look at my back, examine all the x-rays, MRIs, and whatnot, and actually talk to me as a person that's in pain. I couldn't walk very far because my foot would fall asleep. I could not lift up my grandkids and hug them because I was afraid I'd fall down with them. Found out that Dr. Larson was the one person that took their time, talked to me as an individual.
The key to a successful outcome is getting the accurate diagnosis. SI stands for sacroiliac. They're having inflammation of the sciatic nerve as it's passing by the sacroiliac joint. And it's this area that can mimic low back pain, it can mimic pelvic pain, it can mimic hip pain, it can mimic leg pain. And it's often overlooked. When I first saw Cathrine, she came in with what I felt was a radiculopathy. She had an L4-5 disc herniation. She's a very, very active person. This is a person who played college athletics. I treated that disc herniation. Her radiculopathy got better, parts of her leg problem got better, but she continued to have low back problems. I started to evaluate her hips, her SI joints, other areas, and she proved to have SI joint dysfunction. So we tried a course of non-operative management, and none of that got her to where she needed to be. In my opinion, the next step was an SI joint fusion with SImmetry. The hardware that's used in SImmetry is very strong, it's robust. It still can be put in the least invasive way possible for an SI joint fusion. And remember, by the time she had her 2-week follow-up, there was a little different smile on her face, and this continued and continued.
I can walk, can't jump quite yet, but I can lift my grandkids, I can hike, I can hunt, which I love to do. I just have a wonderful life now, and I feel like when my husband retires next year, we can go and do things we've been wanting to do for years and years that we never could do 20 years ago.